If you can't hear me, please say so. I'm Stephen Rudzak. I'm a physician. Sorry?
Speak up.
Okay.
Thank you.
That's right. It's my wife.
I'm getting hard of hearing.
That's great.
But obviously, talking to you from the standpoint of me being a physician, but also as a dad who has had two sons go through St. Gregory and T.K. Gorman, and who have done well. Thank you very much. And we're glad that they did go to school here. It's a great school. But also talking to you as a Catholic and my perspective on vaccines. And I've read the Vatican document related to vaccines, and I've got copies of it at the table if you would like to have one. So let's talk about vaccines in general, and obviously as a physician, I'm a proponent for preventing illness, to prevent suffering and death, and it's what I've done for almost 30 years. So we'll talk about, generally talk about vaccines and how they work and why they're given, why vaccinate, the impact of vaccination over the last century or so, the safety of the vaccines, the risk, because there are risks, and the benefits to vaccines. And then finally, my recommendations to you as a physician, as a dad, as a Catholic, as to what I would suggest. Vaccines help the body develop immunity. Vaccines don't treat anything. They can't cure anything, but they prevent disease. And we'll talk about some of the more ominous things that they prevent. You activate the immune system by exposing the immune system to something that's disease-like. Okay, so in other words, the patient may develop very mild symptoms, but not the full-blown disease. And subsequently, they don't suffer the way you would with the natural disease, and they don't have the risk of dying from the disease. The body makes these things called antibodies, which are proteins that are produced by white cells. And the nice thing is those antibodies stay in solution in the serum for a long time. Sometimes you have to take a booster shot. Sometimes you don't. Sometimes it's lifelong immunity. Immunity can be natural immunity, and that's the kind of immunity that you get from your mom. When you're born, you got some antibodies in your bloodstream that came across the placenta from your mom's blood. But those don't last very long, so your body has to start making its own antibodies just as soon as you're born. Because as soon as you're born, you're exposed to all the things in the world immediately, bacteria and certainly some viruses. So as soon as a child is born, then they're at risk for infection, and they have to start developing immunity. Passive immunity is, natural immunity is when you actually get the disease. Passive immunity is when you get the antibodies from your mom. The other thing is that I can give patients immunoglobulins, I can give them injections, but it has to be specific to the disease. As an example, somebody comes in, they've been bitten by a dog, and we're concerned that the dog might have rabies. Well, I really can't wait for the patient to manifest the symptoms, so I need to go ahead and start treating them ahead of time. And so I can inject around the side of the bite with immunoglobulins, which can immediately start treating the infection if it's there. And then I can give them immunoglobulins in their bloodstream to help avoid the possible rabies. Active acquired immunity, or actually the vaccines that we give people, they can be permanent in some cases. In other cases, they're temporary and they require boosters. Sometimes in medicine, we don't know. We devise these vaccines and we're really not sure how long that they last. A good example was the Pneumovax, the pneumonia vaccine that we give to elderly people, typically when they're about 62. At first, everybody thought that it was a one-time thing and people would be done. And then we realized that didn't work, that after about 10 years that they would need to be revaccinated. And then we realized, it's more like 7 years. So things kind of evolve in medicine with regard to our understanding of immunity and how permanent or temporary it may be. Vaccine effectiveness really depends on the person receiving the vaccine. The vaccines are all standardized, so each vaccine is pretty much the same, but we're different. My immune system is different, your immune system is different. Some people have immune systems that don't respond as well to stimulants from what they call antigens or disease. A good example are people who are diabetic, who just inherently don't have as competent immune system as other people do. Genetic factors, age, older people don't generate the same immune response that younger people do. Adherence to vaccine schedules, some people forget to get the second of a series or the third of a series, and subsequently their immune response is not as good. And so that's why it's so important to adhere to the schedule so that the kind of immunity they develop is appropriate. And then finally, the type of the disease and the strain of the disease can make a big difference. So why vaccinate? It really goes back historically to some of the really bad diseases that have inflicted mankind over the past couple of centuries. And the classic one is smallpox. Smallpox is a horrible disease. It's a virus that infects people. It's very easy to get. It's very contagious. And smallpox, during the course of the 20th century, is thought to have killed somewhere between 300 and 500 million people. So it's a very virulent disease and a lot of death, a lot of suffering. And the people who survived it were permanently disfigured and scarred. Joseph Stalin had smallpox, and that's why, and you see good pictures of him, you'll see the disfigurement. But it manifests with these pustules on the body, and ultimately many of these people died. But you know, if the concept of 300 or 500 million people, I mean, that's hard for me to even realize. And what I have to do, I have to go back to some other benchmark so that I understand how significant that is. And what I do, I go back to World War II. Okay, big war, atomic bombs, the Holocaust, millions of people being killed, murdered, and slaughtered in battle. And World War II, there were about 50 million people that were killed. Okay, 6 million Jews, hundreds of thousands that died at Hiroshima and Nagasaki. All right, so smallpox outdid that by quite a bit. So it's amazing to realize how virulent that disease is. The CDC declared in 1980 that smallpox had been eradicated. So we don't really have to worry about that anymore, or do we? After the terrorist attacks of 9/11 in 2001, a group from the CDC and the federal government came to East Texas, came to Tyler, and vaccinated about 50 nurses, physicians, and healthcare workers against smallpox. Okay, why would they do that if smallpox were eradicated? Well, obviously someone somewhere is concerned about the possibility of smallpox recurring, whether through bioterrorism or through just nature. And the reason I know that is I was one of the physicians that was vaccinated at the time. So it's a concern. So when you stop and think about what would happen in Tyler, Texas, if one case of smallpox occurred, and let me kind of walk you through it briefly. The first thing that would happen is, number one, it'd be misdiagnosed, right? Because no one's seen this disease in a long, long time. Through training and everything, and I've been doing this for 30 years, never seen smallpox. So it'd be misdiagnosed, which means that there'd be a delay in treating or quarantining the individual. So you've got this individual out there who's infecting family, friends, classmates, fellow workers, whatever, the general public, going to church, going to the mall to shop, etc. And so the disease is spreading because it's a very virulent disease, which means that finally when somebody discovers that there's something really bad going on out there, the way that they did with Ebola a couple of years ago, they quarantine everyone. So the victims' families, anyone who's had contact with them. And so you've got literally hundreds of people being quarantined. And realize, once again, there's no way to treat smallpox. You can't cure it. So all you can do is quarantine these people and make them comfortable and hope that they survive. In the meantime, the government comes in with all this smallpox vaccine, right, and tries to vaccinate thousands and thousands of people, which is great. But the problem with that is it takes about 2 weeks for you to develop immunity. So once you've been vaccinated, you're still at risk, you're still vulnerable to getting the disease regardless. So that's why some of these diseases can spread so rapidly from a single case. Polio is another good case historically of a virus that can afflict children and adults. They call it infantile paralysis. It affects the muscles, causes weakness and atrophy of the muscles, including the diaphragm, so a lot of people can't breathe. And this is a disease that's actually still active in the world. We have the polio vaccine, and so we really don't see cases in the United States, but in Afghanistan, Pakistan, India, and some cases in Africa. And these are sites that we don't see in the United States anymore. The iron lung, people who couldn't breathe because of polio, and they were put in this iron lung for months, perhaps years at a time, until they could breathe on their own. And we don't see this now. They've got ventilators that they can put people on, do a tracheostomy, and keep them alive that way. Tetanus is another horrible disease that has pretty much been eradicated because of the vaccine. And this is actually comes from bacteria. The old thing about stepping on a rusty nail. And it's not the rusty nail, it's the spores of the tetanus that enter the skin, and then the bacteria produce a toxin. And the toxin causes these muscle rigors where you go into muscle spasms, and the spasms can be so bad they can break bones. And so it's a horrible disease, very painful. A lot of these people die. It's very difficult to sustain these people and get them through without dying. Bacterial meningitis is another really horrible disease. It happens very quickly. The people who are at most risk for bacterial meningitis are younger people who live in college dorms or Army personnel in barracks when there's a number of people all in one small area. There's a vaccine for preventing bacterial meningitis. Typically, you give it to young people when they're 14, 16 years of age, before they go to college or go away to the military, with the concept of, once again, protecting them. This is a bacterial disease. A lot of times, by the time it's diagnosed, brain damage has already occurred. People stay in ICUs for weeks. Frequently, they lose limbs because people become septic, and they lose circulation to fingers, hands, toes, feet. And I've got one of my patients now who's an older fellow, but survived meningitis when he was a young guy in the military. But he lost both of his feet right at the midpoint there. They call it transmetatarsal. So when we look at what has happened with vaccination, like I said, vaccination doesn't cure anything, but prevents disease. So the people that actually acquire smallpox would either die or survive. There was no other way. But once we started to vaccinate people on a global basis, and we saw a rapid decline in the occurrence of smallpox around the world. Likewise with polio, a very dramatic change as soon as people were being vaccinated across the board. You know, still in a lot of third world countries, people are not vaccinated, and subsequently, if you're going to see these diseases, typically that's where they occur. And measles, and the reason I put this in there is I was born in 1958. You look at the number of deaths that occurred just as a result of measles. And I think that generally we consider measles one of the more milder childhood diseases someone can get. And yet you can die from it. So the vaccine has saved a lot of lives. In 2008, there were actually 64 cases, 54 cases from immigrants that came out of the country that were not vaccinated and acquired the disease. Of the 10 cases that were not immigrants, 9 of those people had not been vaccinated, and 1 had been vaccinated, and the vaccine simply didn't work. Okay, so that's one of the risks. And that just shows you how rapidly the number of deaths and cases of measles declined after widespread vaccination occurred. This is just a list of the common vaccines. These are the inactive vaccines, and what that means is these are dead vaccines. They're dead viruses, dead bacteria that are injected that still cause stimulation of the immune response. These are live vaccines that have been attenuated. They're weakened to the point that they can't cause the full-blown natural disease, but still produce the immune response. These are just a list of the regimen of vaccines that children get now through 6 years of age, and it's a lot. It's a lot, but then the point being that these are the things that we know will help prevent disease. And this was just kind of a nice summary in terms of taking a child through adulthood. And of note is the human papillomavirus vaccine that can be given to young people before they become sexually active. And the reason is that that's the virus that causes cervical cancer. There's been a lot of criticism of this particular vaccine, and it's easy to criticize unless it's your daughter that dies of cervical cancer. And then you realize that it's great if you can actually prevent one of the forms of cancer. The other vaccine is the meningitis vaccine, which we talked about. It's a one-time vaccine, usually in mid-adolescence, that can prevent bacterial meningitis. And this is a very busy slide that talks about the different diseases, how they're spread. And most of them are by aerosol. You can just simply breathe the air and get the disease. Some of them require contact, and then obviously the rusty nail scenario. This is talking about a program vaccinating uninsured children, because not everyone can afford to go to the doctor and not everyone can afford the vaccines. We're just talking about the projected savings in lives and suffering and cost in the United States by using this and vaccinating these children over the course of about 20 years. And it's been pretty remarkable. The irony is now the people who are refusing to give their children vaccine typically are more affluent white people, whereas the poor people and minorities are getting their children vaccinated. So let's talk about the risk versus benefit. And we know that there are risks to getting vaccines. There's no doubt. But it's really interesting to compare that to the benefit and the potential life-saving effect of having a vaccine. Typical vaccine reactions, the thing that we all remember is the pain of the injection, potentially fever, feeling bad for a day or two, the malaise, the myalgias, versus a severe reaction, which can be as bad as a febrile seizure. Febrile seizure is something that can happen in children, typically when the temperature gets about 106 degrees. Less than 5% of kids that get the MMR injection get a febrile seizure. Febrile seizure is very scary to a parent. It's a full-blown seizure, and then it resolves. And then you don't need medication, don't need fancy workup, whatever. It's typically a one-time thing, and then it's done. But it's a frightening thing. The other thing that can happen are really severe reactions. Some people have anaphylaxis, which that's the kind of allergic reaction where your throat swells and you have difficulty breathing, your blood pressure drops, and you can die if it's not treated right away. In 2017, there were 33 cases of anaphylaxis to vaccines. Over 25 million vaccines that were given. There were no fatalities. None of the anaphylaxis occurred in children before. And of course, the obvious question is, if these are such bad reactions, why weren't there any deaths? And of course, you go back and think, well, where do these vaccines typically, where are they given? It's usually in a doctor's office, right? So most physicians, if they give vaccines, are prepared to deal with this. And the way that we deal with this is giving epinephrine, adrenaline quickly. And that's why there was such a concern about the EpiPens, right, that people can buy and keep at home, keep in the purse, keep in the car. You just take the top off and jam the thing into a muscle and inject the epinephrine that way. And the drug companies, in their wisdom, raise the prices of like 10-fold or 20-fold. And of course, that's one of the things that we're concerned about is the ethical issues related to the pharmaceutical companies and what they're doing and why they're doing it. So despite the fact that there were some severe reactions, nobody died. So are vaccines safe? Yeah. In medicine, believe me, if you have one bad reaction in a million cases, that's safe. That's considered really incredible. Are they perfect? No. No one ever claimed that they were perfect. There are definitely risks that go along with it, and parents and adults need to be aware of the risks when they get these vaccines. So what are more dangerous than vaccines? I'll talk about three very basic fundamental things that we're exposed to all the time that are riskier than vaccines. One is Tylenol, liver toxicity related to Tylenol. And these are the numbers of fatalities related to Tylenol ingestion over the course of about 10 years. Okay, so roughly 150 cases a year. And these are the cases related to suicides using Tylenol. And the reason that this happens a lot of times, you have kids that are eating Tylenol that think that it's candy, and they'll overdose on Tylenol. The other thing that we saw when we were in training, we'd see people come with an overdose, and they would overdose with the drugs that were narcotics. And they didn't realize that in the narcotics were also some element of Tylenol. So they would come in, we had no idea how long they'd been untended or been down, they'd come in by ambulance, and we would treat them for the narcotic overdose, and we'd save them, we'd bring them back. But with Tylenol overdoses, a very narrow window of opportunity to treat them for the Tylenol overdose. If you miss that window, then the inevitable that happens, and that is death by liver failure. And so these people would wake up, they'd be alert, interacting with their family, happy, and then they'd go into liver failure because of the Tylenol overdose and die about a week later. Peanuts, more dangerous than vaccines, no doubt about it. Latest data shows about 200 people a year die from food allergies. About 15 to 20% of those are peanut allergies. And once again, it's no big deal. We eat peanuts all the time. Not a big deal. In fact, they say that about 75% of us eat peanuts on a regular basis in some form. Okay, but with a lot of people, just even having a small amount of peanut oil in some of the food can be disastrous, and they can die. Medications are more dangerous than vaccines. Okay, I think that we all know that. When you look at the reactions, adverse drug reactions versus vaccines, antibiotics, and when they talk about adverse drug reactions, we're talking about a reaction that prompts somebody to either go to a hospital and be admitted or go to their doctor because it's so severe. So in antibiotics, about 1 in 5, antidepressants, about 1 in 3, blood pressure medications, about 1 in 4, insulin, 1 in 4, analgesics, the narcotics, certainly. And we see this all the time. And you don't necessarily see it in young people, but because I take care of an older population, I see these kinds of problems all the time. Everything from simply people being constipated to being in liver failure, or I'm sorry, kidney failure, or having peptic ulcers because of these analgesics. So adverse drug reactions, over 2 million a year, 100,000 deaths annually. The fourth leading cause of death had a pulmonary disease, AIDS, diabetes, pneumonia, etc. In nursing homes, 350,000 of the drug reactions that we see in the elderly. So immunization myths, I'll talk about this briefly. And just so you know, I've got a handout addressing these myths and kind of documenting the things that we're talking about. The obvious one is the one about vaccines causing autism. There was a physician, a British physician, Andrew Wakefield, who published a paper in 1998 in Lancet, which is a journal, that claimed that autism was caused, the increased incidence of autism subsequent to vaccines. And it caused a real furor. Everyone is really concerned about vaccines being safe subsequent to that. A couple of years later, after people started to look at the study, they realized it was a very weak study. There were very small number of people that were involved. And then some of the co-authors started retracting their findings. The Lancet retracted the article. And about 2 years later, Dr. Wakefield lost his British medical license because they discovered that there was fraudulent material that's introduced into the article. Since then, obviously this has expanded, and although I don't know of any other good studies that have demonstrated that vaccines cause autism, the myth is still out there. And like I said, I've got some documentation you can look at with regard to the good studies that have been done. You can look at and kind of examine these things for yourselves, kind of draw your own opinions. Thimerosal causing autism. Thimerosal is a mercury compound that has been in vaccines for many years. There was a concern about thimerosal causing autism. Two things. Number one, the kind of thimerosal, it's a mercury compound. The kind that was in vaccines is called ethyl mercury, which is benign. The kind that's dangerous to the central nervous system is called methyl mercury. And I know it's chemistry and it's confusing. Methyl mercury is the stuff that you eat when you eat fish, and it's got mercury in it. Okay, that's the dangerous type. Because of the outcry and the concern about thimerosal and vaccines, it was removed, with the exception of flu vaccine. It's still in flu vaccine. And what they did, they looked then at the incidence of autism occurring in patients who were getting the vaccine without thimerosal, and there was no change. In other words, they removed the thimerosal, and the incidence did not go down, which is what you would expect. Giving multiple vaccines overwhelms the immune system. Not true at all. The immune system is incredible, like our bodies in general. We respond well to anything. I mean, if anyone is going to be overwhelmed in the immune system, it would be me, because I'm exposed to sick people all the time. In fact, if you want to overwhelm a child's immune system, then what you do is you put them in daycare. Right? Okay, that's it. Or send them to summer camp. And that's a good way to overwhelm their immune system. Natural infection is better than immunization. That's probably the more inane thing that I've ever heard, to consider the fact of exposing your child to the full-blown nature of a disease so that they would get immunized. That's the whole concept of vaccines, is so you can minimize the risk and still have the benefit of immunization. And then finally, vaccines are not effective. We heard this a lot about the flu vaccine and about the zoster vaccine, which is for chickenpox. What I can tell you is, in my experience, is that the people who do get the flu vaccine and still get the flu are a lot less sick than those who don't and get the flu. Once again, because our bodies are variable in the way that they respond to vaccines, sometimes people don't get the full benefit of protection that you would hope that they would. And we know, and the data, the statistic that I've always been told since I was in medical school, is that 5% of people who get the flu vaccine are going to get flu-like symptoms. And it happened to me once. So I was miserable for a few days and then I got better. But the year that I didn't get the flu vaccine, I got the flu. And I was really sick. And so I learned, yeah, for sure, you have to get the flu vaccine. Last January, we had a really bad flu season. The hospitals were overwhelmed. We had literally hundreds and hundreds of people trying to get in that had the flu. The pharmacies were running out of medication to treat the flu. And, you know, day after day, I was this close to people that had active flu and didn't get the flu. In fact, none of the physicians I worked with got the flu, but we all got the flu vaccine. Same thing with the vaccine to shingles. Shingles is a very bad disease that you don't want to get because it's very painful. And it's subsequent to having had chickenpox as a child, it's the same virus. And it tends to happen at one side of the body, this blistering rash that's extremely painful. And once you get the shingles, you're at risk for having them again. And so it's always best to get the vaccine ahead of time so you don't deal with it. If you ever talk to anyone who's had the shingles and ask them, should I get the vaccine, you'll get a positive response. So the future of vaccines, and this is kind of looking to the future, while a lot of people are trying to minimize the vaccine that people are getting, I'm looking at new things that we can vaccinate people for. Ebola, obviously, we've got an outbreak now in Democratic Republic of Congo. 45 cases, 25 deaths, 3 of them healthcare workers. They're trying a new vaccine now. Obviously, it doesn't work for the people that already contracted the disease. This is only for the people who haven't gotten the disease yet. HIV. I'm one of the physicians who was in a generation during the 1980s that we took care of a lot of young men who were HIV positive, who had AIDS. And all of these young men were getting these really unusual infections. And it was inevitable that they would die. You know, it's unusual now because we've got these great drugs that suppress the virus and really minimize the risk of having one of these bad diseases or cancers. But the concept of having a vaccine would be great. It's been very difficult to devise a vaccine because the virus changes so rapidly. But they're trying to do that, and hopefully it'll occur. Hepatitis C, another viral disease that hopefully will have a vaccine sometime. My best friend in high school died last year from hepatitis C. Okay, hepatitis C can be treated, but only certain subtypes. So once again, we hope that for the future, for our children's benefit and for other adults, that they'll have a vaccine at some point. Herpes simplex type 2, sexually transmitted disease, which some people feel that 1 in 25 Americans have at one point or another. And you hope that once again, that somehow we can develop a vaccine that'll prevent this in the future, so that one, indiscretion when you're young is not something that'll mark you for the rest of your life. Other cancers, Epstein-Barr virus. Epstein-Barr virus is a virus that causes a mononucleosis, right? And generally that's not a life-threatening disease. Make the kid really sick and miserable, but usually they recover. The other thing that it can cause is a Burkitt's lymphoma, which is not benign. It's a very aggressive lymphoma that will kill children if it's not diagnosed quickly. In the United States, if you diagnose Burkitt's lymphoma early enough, then you have about a 90% survival rate with chemotherapy. In Africa, the survival rate is about 10% because they don't have the resources that we have in the United States. Adults that are diagnosed with Burkitt's lymphoma invariably die. So my recommendations to you, as a physician, as a dad, as a Catholic, number one, get a good pediatrician for your children and listen to what they say. You know, it's a fair question to ask them, if this is your child, what would you do? Okay, and see what they've done. Most pediatricians are moms and dads, and they'll tell you honestly what they think about vaccines and the safety versus the risk. Use good sources of information. Social media is not a good source. It's a real problem, the things, the opinions that people put on social media. And unfortunately, a lot of people follow that advice, and it's not good advice. Beware of personal accounts. A lot of times people don't realize what's happening and why things happen, bad things happen. A good example, I had a lady a couple of weeks ago who came in with a nice old Polish lady I've been taking care of for a long time, came in with a sinus infection. And I gave her an antibiotic. The next day she called and she said she's having trouble breathing after she took the antibiotic. And of course that got my attention right away, so we brought her in. And she said, yeah, since I took the antibiotic, my chest hurts, I'm having trouble breathing, the pain goes up to my neck and down my left arm, and my heart is racing. I'm like, okay, well, I'll tell you what, why don't we check your heart while we're watching you for this reaction. In fact, she was having a heart attack. She was having a myocardial infarction. And it wasn't because of the antibiotics, it was because her left anterior descending artery was about 98% blocked. Okay. But in her mind, it was a direct reaction. And so people's personal accounts, the way that they feel, and from now on, believe me, she'll tell you to avoid that antibiotic that causes heart attacks. So you just have to be wary of personal accounts. And then finally, not finally, but vaccinate children and adolescents, do it as soon as possible, use an appropriate schedule. Then finally, if there's any doubt about the ethics of vaccines, talk to your parish priest. The priests in this diocese are knowledgeable and articulate and well-read. The bishop's a pretty smart guy too. So, talk to them about your concerns and ask them about whether these things are ethical and appropriate for a Catholic. Good references on all of these websites have great information on vaccines. So American Academy of Pediatrics, the Children's Hospital of Philadelphia, and the CDC, obviously. And it's good information, and they'll give you reference with regard to the studies that have been done with regard to safety and risk. And this is just a verse that I like. Every once in a while you're reading the Bible and you come across these nuggets, these jewels, and it's really remarkable. But it says that man is but a breath, his days are like a passing shadow. And what it does is it just reminds me as a physician how fragile and fleeting human life is. And so all the more reason to really protect it. Father?
So I'll continue from the moral perspective. And again, like in the last presentation on immigration, we want to have a clear understanding of how to analyze these particular things from a Catholic perspective, because there's no Bible verses about vaccinations. The Bible doesn't speak about this. Jesus didn't say anything. We don't have any reference about vaccinations, because obviously they didn't exist in the time of Jesus. So what can we do? And this is where we have the personal example of Bishop Strickland, where he talks about quite openly in the early years of his priesthood, people would come up to him and say, "Hey, Father Joe, Father so-and-so told me that this is a sin. What do you think?" And he knew what he thought, but sometimes there was a conflict. Well, who's right? And so thanks be to God, this is where the Catechism of the Catholic Church came along, and therefore, "Hey, Father Joe, is it a sin?" You would just open it up in the green book. Well, this is what it says. I mean, this isn't me. This is the church talking here. So we see this in his articles in the Catholic East Texas frequently, the numerous citations of the Catechism. For him, it was a life-changing book, and so it should be for us. We Catholics can take the Catechism as the authoritative commentary on sacred Scripture. How do we take the Bible and apply it in our everyday life? Through the Catechism. So this is a book that every Catholic family should have. So, even though the Catechism doesn't have a specific paragraph about vaccination, the problem with vaccinations, of course, is addressed in the Catechism in paragraph 1868. Sin is a personal act. Moreover, we have a responsibility for the sins committed by others when we cooperate in them. If someone does something wrong and I cooperate with them, then at a certain level I'm sinning too. Catechism describes the 4 different ways. By participating directly and voluntarily in them with my will, by ordering, advising, praising, or approving of them. I don't actually do it myself, but I open the door for it. Third, by not disclosing or not hindering them when we have an obligation to do so. And we all know this, when we see parents who do not discipline their children, we get upset with them because, in a sense, yes, they cooperate in the evil of their children, if you will. And then fourth, by protecting evildoers. We understand this particularly in the Catholic Church in the last 20 years. Certain bishops didn't necessarily abuse children, but they protected priests who did. And we hold them just as responsible. They cooperated in that evil. They didn't actually do it, but they cooperated in it, and we wish to hold them as responsible as well. So with vaccines, as Dr. Bidzak just explained, the development of vaccines marks a huge achievement in science and in medicine. Now, this is where the cooperation comes in, because we know that certain vaccines were developed by infecting fetuses, sometimes, yes, in the womb, and then aborting them shortly thereafter, for the sole purpose then of developing the strands that are necessary so that a particular vaccine can be made. And so yes, an argument is made, and it's true. By using those vaccines, we cooperate in that evil. I know that this thing that was done here to make this particular good this particular thing was evil, and therefore if I choose to use it, I cooperate in the evil of that thing that was made. Seemingly a link then exists between our action and the evil carried out to produce the vaccine. This is the issue that gets raised. Now, we have to understand cooperation more clearly. There's multiple layers to this. First, formal cooperation, cooperation by sharing in the evil intention. In my will, I choose to be a part of the evil thing that's taking place here. This is formal cooperation. And it is always wrong. There's never a time where I can choose with my will to cooperate with the evil that's being done. The second distinction that has to be made here in terms of cooperation is material cooperation, where I'm cooperating in the evil action without sharing in the same intention. We're going to see some examples of this. Material cooperation is not always wrong. There are instances of licit material cooperation where I recognize that this thing is bad, but I'm not using it for a bad purpose, perhaps, and therefore I'm separating myself from that. The material itself, perhaps in its history, has something evil about it. I don't wish to associate with that, though, in any way. Further distinctions can be made regarding material cooperation. That's where we get some of the examples. Providing instruments or products to make possible in the immoral act. So, something immediate and direct. It's very close, if you will. You come into my gun store and say, I want to go kill my spouse. All right, here's the one you need. Well, I'm being very direct in terms of this is the material, and I'm very clear this is the best one to bring about the thing that you want. Now, maybe I don't want you to kill your spouse, but if you want to do it, this is the material that you need. Manufacturing Plan B pills. Plan B pills can only be used to bring about either, the death of a child. That's it. There isn't any other ulterior motive with that. There are prescription medicines that have the effects of being contraceptive. Perhaps the lady takes those pills for that medical reason, not for the contraceptive effect. Immediate or indirect. This is give a little bit of separation here. I manufacture assault weapons. Do I manufacture these so that someone can go into a school and blow up a whole bunch of people? No. Now, maybe I do, and if I do, that's formal cooperation at the very top. But from a material standpoint, yes, I'm producing the material that potentially could be used for very, very evil end. I make this material. This gets very tricky, particularly in today's day and age. Those who produce particular things that can be used in an evil way. And I gave this example. I prescribed an acne medication that has a contraceptive side effects. I'm a doctor, a patient comes in, yep, you need this particular medicine. Doctor, what are the side effects? Well, it will change the cycle of your menstrual cycle. Okay. Is that the reason I am prescribing this particular medicine? No. Now, if the lady then takes it and says, you know what, okay, now I don't have to worry about this anymore, well, I did not cooperate in that. I have provided the material, but for a completely different reason. Even further distinctions have to be made with material cooperation in terms of the distance, not only in the temporal space, meaning here I am here, something that's going to take place on the other side of the world, but the material connection between the act of cooperation and the evil act itself. So something that happens today versus something that happens 50 years ago. Things that are proximate, the distance is close. And so, Venezuela's been in the news a lot lately, so this one came to mind. If I'm an oil company, I can choose to purchase crude oil from Venezuela, whether or not I do it because I support the regime or not. we understand by doing that I'm helping the current power in this way. There is a local gas station who is the biggest importer in the United States of Venezuelan crude oil. I see it all around town. If I choose to get gasoline from them, does that mean I support the regime in Venezuela? Not necessarily so. It is remote by that point in time. Here is the gas station. I know that if I know this particular gas station purchases their crude oil from Venezuela, well, okay, yes, I cooperate a little bit, but what if this is the only gas station in town? I don't really have much of a choice from that standpoint. It has been separated for me. I'm not the one at the oil company that's choosing to buy crude oil from Venezuela. I'm way down the line because it has to be purchased from Venezuela, it has to be refined, then it has to be shipped, and then it has to be brought to my little town at this particular gas station. Then we have to also talk about the positive and negative connotation, the connection to the evil act. Active and passive. Active, doing something in relation to the evil act. So I'm a doctor, you wish to have a contraceptive medicine, here you go. A pill, here you go. I actively participate in that. Versus passive, which is the omission in relation to the evil act. And this is important when it comes to vaccines. By not speaking up, that's the second one listed. But to give another medical analogy here, I have lots of friends who are pharmacists. Someone will come into their pharmacy and why do you want this particular pill? It can only be used for contraceptive. Well, or here's a better example would be, here's a pill that perhaps has medical reasons, but it's also a contraceptive. Okay. By the pharmacist dispensing it, I didn't choose this particular medicine to be given to you. I'm very passive in the sense that this is what you need and want. I don't know the reasons for it. I'm not the doctor. I'm, if you will, shoveling this along. There are states in the United States that do not protect pharmacists who say, you know what, I don't want to dispense contraceptives. I have a friend who was in Illinois, had to move because in the state of Illinois it was not protected. He had to move to another state because he refused to dispense of any and all contraceptives. All right, how does this apply to vaccines? And this is where, as Dr. Ridzak spoke about, and he has copies of it, the document written by the Pontifical Academy for Life makes this very, very clear. And we're going to discuss some of the first sections very, very quickly, but then we will literally read word for word the primary content for the moral aspect of this. When it comes to vaccines, there's three types of classes of people that we're talking about. Those who make them, those who mass market them, and then those who use them for health reasons. And I think for this audience, we fall into that third crowd, those who use them for health reasons. I don't think anyone here is making vaccines or mass marketing them. So for this third group, we cannot have formal cooperation. What would that be? It would be, I'm going to vaccinate my kids because I love abortion and I want to keep that a right, and therefore I'm going to participate in this particular way. And one way that I can show my support for abortion is by vaccinating my kids. I've never heard anyone say that, but that's how formal cooperation would fit into vaccines. The use of vaccines then constitutes, for us, material cooperation. And as the Pontifical Academy for Life has shown, in a country like the United States, this cooperation is very remote. It's the distance, and it's immediate material cooperation. As the document says, very distant connection and indirect use of an instrument made available to us by an immoral act. Yes, it came to us. It's certain for certain vaccines by an immoral act. Yet it's very distant, and our choice to use that is an indirect instrument. So we have this question of active or passive cooperation there at the end of material cooperation. At minimum, when we ask for vaccines, parents can ask for vaccines that were not derived from aborted fetuses. And in the United States, it's true that there are vaccines that were not derived from aborted fetuses that are not available in our country. For one reason or another, they're not available. Some of these are available in European countries, other countries in the world, but not here in the United States. So there's this minimum level. If these alternatives exist, then we use those. Furthermore, how do we not be active or passively cooperating from a material standpoint is to put pressure on our political and medical authorities to make other vaccines available as quickly as possible. All right, now we'll read from the document word for word, particularly the document, just like Dr. Vidzak's presentation, gives a very, very good but brief description of the medical problem, talking about the history. Then it speaks about what I've just spoken about in terms of the philosophy of cooperation, the theology of that applied to vaccines. And then, okay, what are we going to do about this? So, as regards those who need to use vaccines for reasons of health, it must be emphasized that apart from every form of formal cooperation in general, doctors or parents who resort to the use of these vaccines for their children, in spite of knowing their origin, voluntary abortion, this was a fetus in the womb, injected and then aborted, carry a form of very remote, immediate material cooperation, and thus a very mild form of cooperation with evil in the performance of the original act of abortion, an immediate material cooperation with regards to the marketing of cells coming from abortion. So remember, that's that second class, those who market vaccines, and immediate with regard to the marketing of vaccines produced with such cells. The cooperation is therefore more intense on the part of authorities and national health systems that accept the use of the vaccines. So, who are those people who, for one reason or another, refuse to allow alternative vaccines that have not been brought about through the use of aborted fetuses? They are the ones who bear the biggest guilt for that. In this situation, the aspect of passive cooperation, so this is me not saying anything, is that which stands out most. This is the most important thing. It is up to the faithful and citizens of upright conscience, fathers of families, doctors, parents, to oppose, even by making an objection of conscience, the ever more widespread attacks against life and the culture of death which underlies them. From this point of view, the use of vaccines whose production is connected with procured abortion constitutes at least immediate, remote, passive material cooperation to the abortion. Yes, cooperate in that. And an immediate passive material cooperation with regard to their marketing. So yes, there is a level of cooperation as we choose to use these vaccines. Furthermore, on the cultural level, the use of such vaccines contributes in the creation of a generalized social consensus to the operation of the pharmaceutical industries which produce them in an immoral way. It's true that as we use these vaccines, if there isn't any strong objection to this, what's going to make them go and try to produce new ones? This is legitimate. Therefore, and so it continues, doctors and fathers of families have a duty to take recourse to alternative vaccines, very important, if they exist. In some cases, they do not exist in the United States. They do exist in other countries, the alternatives. But some of the alternatives do not exist in the United States. We have recourse to alternative vaccines, putting pressure on the political authorities and health systems so that other vaccines without moral problems become available. They should take recourse, if necessary, to the use of conscientious objection with regard to the use of vaccines produced by means of cell lines of aborted human fetal origin. equally. They should oppose by all means, in writing, to various associations, mass media, etc., the vaccines which do not yet have morally acceptable alternatives, creating pressure so that the alternative vaccines are prepared which are not connected with the abortion of a human fetus, and requesting rigorous legal controls of the pharmaceutical industry producers. And then, in conclusion, as regards the diseases against which there are no alternative vaccines which are available and ethically acceptable. This is the situation that we find ourselves here in the United States. So this is the paragraph that's applicable to us. It is right to abstain from using these vaccines, but the paragraph continues, if it can be done without causing children and indirectly the population as a whole to undergo significant risks to their health. That second half of the sentence is what becomes important, and this is where the Texas Conference of Bishops, particularly when it comes to their schools, have kind of taken a hard line. As Dr. Rizdak pointed out, immigrants who come typically are not vaccinated. When I lived in Rome, I mean, people from African countries, that's the way they come up into Europe, is through Italy. And yeah, people from all over the world with all kinds of diseases were passing through. The food that Southern Europeans typically eat comes from Africa. Just a little side story, when I first arrived in Italy, people would ask, would you like wine with your meals? And because I'm accustomed in East Texas not to drinking in public because we don't want to offend any of our brethren that priests are drunks and so forth, so I would always decline. And a American religious sister leaned over once and said, Father, you have to drink a little bit of wine with your food. It comes from Africa. Just for your own safety, you have to take a little bit of wine with your food. So I began to take a little bit of wine with my lunch and supper. The following Ash Wednesday, I decided for Lent I'm going to give up alcohol. The Thursday after Ash Wednesday, I was throwing up the whole day. I went back to having a little bit of wine. I never had a problem. I know it's a personal account, but my sister told me, look out for this. So yeah, in our particular situation here, most especially in East Texas, because of the fact that there is a not insignificant population of people about whose health we know nothing about, who are in our grocery stores, going in all the various places that we go. This is why the Texas bishops have taken a little bit of a hard line on this. However, if the latter are exposed to considerable dangers to their health, vaccines with moral problems pertaining to them may also be used on a temporary basis. Kind of like the situation that we're in. God willing, we could reach a point in the future that we don't have to worry about this. The moral reason, why can we do this? Why can we cooperate and use these vaccines? The moral reason is that the duty to avoid passive material cooperation is not obligatory if there is a grave inconvenience. Moreover, we find in such a case a proportional reason in order to accept the use of these vaccines in the presence of the danger of favoring the spread of a pathological agent due to the lack of vaccination of children, which Dr. Rizdak began his presentation speaking about that. And we all recall with Ebola. My sister, who's an emergency room doctor in Texas, this was very much at the forefront of her mind with all of the cases that were popping up even in Dallas. And so it concludes this is particularly true in the case of the vaccination against German measles.